Hi, my name is Rebecca Dale. I'm an associate professor of anesthesiology and pain medicine at the University of Washington in Seattle and currently practice at the VA Puget Sound. I'm excited to talk to you today about the osteopathic approach to chronic pain. My learning objectives for this brief 5 minutes are to describe the principles of osteopathic medicine and talk about how osteopathic clinicians are uniquely prepared to care for patients with chronic pain, and talk about techniques that an osteopathic clinician might use in managing patients with chronic pain. The osteopathic philosophy is really based and embraces the biopsychosocial patient-centered approach to healthcare. It operates on these 4 principles of osteopathic medicine that everyone learns starting from day 1 in medical school. And they are that number 1, the body is a dynamic unit of function. Number 2, that the body possesses self-regulatory mechanisms that are healing in nature. The body is always trying to reach a level of homeostasis. Number 3, that structure and function are interrelated at all levels. And then the 4th principle is that rational treatment should be based on these principles. A doctor of osteopathy, or a DO, understands that good health is more than just the absence of pain or disease. They're going to focus on working with the patient to understand how that patient's lifestyle and environment are contributing to that person's health, their chronic pain, and their suffering. Another unique factor is that osteopaths are taught that structure equals function and that each aspect of the body has a unique role to play in maintaining health. For example, the fascial and lymphatic systems are often targets of treatment in osteopathic manipulation because these systems play a key role in proper overall body functioning and maintenance. So you've just heard me mention osteopathic manipulation, also known as osteopathic manipulative treatment, OMT, and it's something that osteopathic training is well known for and is not well understood by people who aren't trained in it. So I want to give just a brief overview of what it is and what it offers to patients. It's just one aspect of an osteopath's toolbox. It's not going to be the first thing that they might turn to. And it is also both a diagnostic and treatment modality. So generally, OMT are hands-on techniques that are used to diagnose and restore function in a certain area of the body by promoting, for example, as I talked about, lymphatic drainage, autonomic balance, fascial restrictions, and CSF flow, and so on. I don't have time to go into every specific technique. There are hundreds of them. But at the end of this presentation, I give some references, and there are oftentimes classes that are available for non-osteopaths who are interested in learning how to use these techniques. So that's all well and good, but still fairly vague, and you might be kind of wondering, how can this apply to a patient scenario? So in the remaining time, I just want to briefly go into an example of a patient and how an osteopathic clinician might approach the situation. So we have here a 46-year-old who's being seen in follow-up, so this is not the first time you've seen her. She's being seen for chronic primary low back pain. Obviously, all the red flags, everything was kind of ruled out in that initial visit. So you delve into her history a little bit more. She has stable housing. She has this diagnosis you knew about of PTSD from sexual trauma. She's fairly sedentary, her sleeping is irregular, and her diet consists of a lot of processed foods. You want to know what her goals are so that you can align your care with what she's hoping for. And her goal is to be able to be more involved in her child's school. There's some field trips she wanted to chaperone, but doesn't feel like she has the energy to do that right now. You do an osteopathic exam and it shows that she has some tissue changes in the lumbar region, indicating that she may have some either autonomic dysregulation or abnormal lymph flow in that area. So you talk with the patient about your goals and her goals and how your role is to help her body heal itself and regain function. One of the first things you're probably going to look into is her autonomic dysregulation that's really coming from the top down. She has that history of PTSD that you're going to need to address in order to move forward with her care. And so you place a referral for mental health services. And then you talk about physical therapy, the role of gentle stretching and core strengthening, and how this is all working together to help her restore function and structure. And then you have a patient-centered discussion and educate her on lifestyle changes and nutrition, all very important in healing and allowing the body to regain function. And then at the end, you might talk about some osteopathic treatments that might be appropriate for her. Likely going to be some gentle fascial techniques, all aimed to restore peripheral autonomic balance, lymph flow, and musculoskeletal alignment. So here are some of the references that I used for this lecture, and then here down at the bottom, you'll see a link to the American Osteopathic Association if you're interested in learning more about it, or perhaps looking for a class that you could take. They will oftentimes be listed there. So thank you for listening.